Welcome to Lessons in Leadership. Steve Adubato, my co-host, executive producer, Mary Gamba. Mary, I'm pumped up, ready to go.
You're shot out of a cannon today. Yeah. I don't know. It's been too much coffee.
No, I had a couple of cups. But what did Barack Obama used to say? Not pumped up, ready to go. I got to get the right quote. But he would often get people pumped up at rallies, and it's nothing to do with politics. It's about speaking and motivating people. But I'm ready to go. I'm ready to go. And one of the reasons is we're kicking off the show with our good friend, Dr. Dan Varga, Chief Physician Executive at Hackensack Meridian Health, HMH. Good to see you, Dan.
Happy to be here, Steve and Mary. Thanks for having me on.
You got it. Hey, Dan, am I too pumped up today?
No, not at all. Not at all. Love it. Love the energy.
Hey, Dan, let's do this because I want to actually turn this segment and go back on our website that Sylvester will put up, stand-deliver.com. I think this is the 5th or 6th time Dan has been with us. Every time we talk about different aspects of leadership. But this particular segment, I want to focus primarily on this. Dan introduced us to a concept called Dyad Leadership. And on our lower third, on a graphic, I want to put up Dyad Leadership. What, and we're going to use it in our Physician Leadership Academy that we facilitate for HMH with terrific physician leaders there. What the heck is Dyad Leadership, and why did you introduce us to that concept, Dr. Varga?
Steve, Dyad Leadership is something that's been gaining a lot of traction in healthcare for several years now. But the way I really think about it is this. So, there are some business milieus where the competencies required for leadership are so complex and at the same time so divergent that you need to marry them. And you can kind of hope and pray. And we all know that hope is not a strategy. Prayer is good all the time, but hope's not a strategy. So when you look at this, you can hope and pray that you can find one individual who can merge these incredibly complex and divergent capabilities. But more often than not, what you find yourself is leaving a big chunk of the complexity unattended in order to get somebody who kind of knows this piece, really knows this piece, or vice versa. The concept of a dyad leadership model say, let's acknowledge that these things are very complex and very divergent, and let's get a team, at least of 2, to come together and lead the organization by marrying these 2 elements together. An important caveat, at least from my perspective, is this isn't management. I mean, we all know about when you're leading in a management milieu, you've got lots of silos and you have to figure out how to make a team of teams and all this sort of thing. This doesn't replace any of that. This is saying when you get way up at the top of an organization and you need to lead, but you need somebody to embrace these diverse complexities that exist in the organization, maybe think about having a dyad model of leadership. So I'll give you the example in healthcare.
Sure.
You've got incredibly complex operating models, right? You're running hospitals, ambulatory services, home health, physician practices, a whole bunch of operating things that you have to deal, supply chains, pharmaceuticals, et cetera. And then you have this thing, which is the widget of healthcare, which is the delivery of care, clinical care delivery. We've started to embrace in a lot of different situations, and this can either be structural or functional or both, really bringing 2 individuals together who have the clinical skill set and the operating skill set and say, let's marry these. And now we've got clinical operations. And that way we don't separate those 2 things. We don't either A, have the clinical piece of that overwhelm the operational and financial and logistical piece of the operation, or vice versa. So, I mean, we've seen this. I think some organizations have gone all the way to the top where, in fact, the P&L of the whole health system comes through a dyad model. You see it more frequently in things like clinical service lines. So like the way you run cardiology at your health system is you get a clinical leader who can create that unique, differentiated, exceptional care delivery model, and a strategic business leader who can operationalize it, strategize it, and monetize it in the marketplace.
You know, Mary, before you jump in here, it's so interesting because Dan is talking about this dyad leadership model. And we are actually incorporating that into the Hackensack Meridian Health Physician Leadership Academy, whereby, without getting too into the details, Hackensack Meridian Health, like any great organization, has strategic initiatives. On these strategic initiatives, important things that need to be done, we're working to marry, if you will, join a clinical leader, a physician leader in the Physician Leadership Academy with a non-clinical leader within HMH to work together on that. Now, real quick before Mary jumps in, devil's advocate. You can't have two quarterbacks. Come on, you can't have two quarterbacks. You can't have two head coaches. It's confusing. Nah, go ahead, Dan.
No, that's a great point. And I think at the end of the day, everybody, even if you're in a dyad model, there's still specific elements that you have one member of the dyad, overweighted, if you will, in terms of their accountabilities and vice versa. But at the end of the day, as you strategically plan, as you build annual budgets, as you look at clinical performance accountability, operational accountability, you hold these two people equally accountable for the whole kit and caboodle, as opposed to say, Dan Varga is a chief physician executive, and Dan is going to be accountable for the clinical performance of the organization, and he doesn't give a fiddler's damn about the operating performance. Steve Adubato is running the operations of the health system. And to be quite honest, if we're not at the top of the heap on clinical performance or clinical capability, Steve's fine. He hit his budget, hit the operating parameters, et cetera. He's all okay with everything. It's where it's not just an issue of leading from a joint standpoint. It's also creating joint accountability for the two leaders in that setting.
Dan said this in an offline conference call. I shouldn't share this publicly, but I remember he said that Mary and I are a dyad leadership model. Mary, do you see it that way?
Yeah, no, definitely. I think it's the yin and the yang. It's and I talk about this as well, even in law enforcement. You have somebody that's the head of custody and somebody that's the head of administration of a prison or of a, if it's the chief of police, and there has to be different roles. But that is an interesting question that you brought up, Dan. Dr. Varga, if something does go wrong, who owns it then? If you do have two quarterbacks, who owns that mistake, and how do you handle that in that situation?
So it's really joint accountability. One of the things we always talk about, and Bob Garrett's been,
Bob Garrett, the CEO of Hackensack Meridian Health.
Absolutely.
Check out previous episodes of Lessons in Leadership for Bob. Go ahead.
That's right. So Bob has emphasized this. I emphasize this all the time. When you think about it, there's two jobs in healthcare. There are people who take care of patients and people who support people who take care of patients. Take those two very simple job descriptions. What you do is you say, when you look at that, they're inextricably interwoven. And so when you say who's accountable, the person who's taking care of the patient and the person who's supporting the person taking care of the patient, that's who it is. And the dyad model not only marries complementary capabilities and competencies, but it also marries accountability. I mean, look, I'm a doctor. I know healthcare finance pretty darn well as an operator, as a clinician, et cetera. But I'm not a CFO by any stretch of the imagination. But I have to make sure that the way we deliver care in this organization helps us meet our strategic goals, our financial goals, our patient satisfaction goals, our team member engagement goals. You can't isolate them. And so the one thing I think dyad leadership does more than anything is, while everybody's still kind of exercising their unique capabilities, their unique competencies, you've married accountability.
Mary, it's so interesting as Dr. Varga is talking about this. One of the things that strikes me, and I want to talk about this, we'll talk about this when we finish up with Dan as well, because this dyad leadership model has me thinking an awful lot about this. One of the things it takes, Dan, it seems to me, to be a part of a dyad leadership model, I'm not going to say the lack of ego, because that would mean that I could never do it. That being said, that was a joke, Dan. So
I'm smiling.
But you do have to submerge some of your quote unquote ego or narcissism, whatever you want to call it, because you can't do it alone, nor should you be trying to do it alone. If you try to do it alone and get the credit, if things go well, the organization doesn't benefit because you don't have the entire skill set. Go ahead, Dan.
No, I agree with that. And, look at any great performer, that lives in a team environment. I mean, take a pro sports team. I mean, we all know Tom Brady's the greatest of all time, as a quarterback, right? And I know that, here I'm in the Metro New York area, and we don't necessarily like to talk about Tom Brady, but there you go. Absolutely. Well, let me say, Eli Manning. Eli Manning was a great leader, but I don't think anybody, and I'm sure Eli's got more than enough ego to do the job he needs to do.
Yes, he's a big part of the HMH family and a big part of a capital fundraising campaign. And just, I'm sorry, go ahead.
No, but absolutely. But you look at that scenario, and the bottom line is that one guy versus 11 isn't going to win. And you think about it, the lineman capability, the running back capability, the wide receiver capability, the quarterback capability are all different capabilities that all get merged into this thing. Now, at the end of the day, there's a leader there, right? Somebody's leading on the field. But in this scenario, and I think that's where it's important to get away from the management element of this, which is you got to manage as a team. And we all know the concept of team cohesiveness and team function and team optimization. But that's more at a management level. Here, if you can't marry the defensive, strategy and the offensive strategy and the special team strategy and the player acquisition and personnel management strategy, then you're going to have a dysfunctional team, right? Same sort of thing here. This doesn't replace individual competency, but what it lets you do is to say, when we're thinking about clinical performance and operating performance, when we plan the budget, we do it together. We hold ourselves jointly accountable for both elements of that performance going forward, whether you're talking about the whole organization, a clinical service line, or one other isolated function of the organization.
That's complex, important stuff. By the way, let me also do this. I know I had the Giants hat up before. I mentioned Eli Manning and Peter Cankro, along with who is the founder of Jersey Mike's, right, Mary?
Yes.
They're actually at the HMH annual meeting. This was announced by Bob Garrett, who is the biggest Giants fan of all time, in all seriousness. They are the co-chairs of a major capital campaign on the part of HMH. But I want to say this, Mary, as it relates to HMH's Physician Leadership Academy, not only will we use this Dyad leadership model and practice it in real life, but I want to say this to folks watching right now. Those of you who think that being a great leader means it's all on me. Yeah, it doesn't, ultimately it is, I get it. But think about what Dr. Varga is saying. People who think they can do it alone or insist on doing it alone because if you want it done right, in this complex world we're living in, it doesn't work. I'm sorry, I'm off my soapbox, Dan.
No, that's in large part the piece here. And I do think that particularly, and I can speak personally from healthcare, we have grown a lot here where, think about the clinical care delivery model. It was always the doctor was the captain of the ship. And we have migrated a long, long way in the 30 years I've been, a physician. We've migrated a long way from that concept of the very vertical sort of care delivery model with the doctor and the nurse and then techs at the bedside, et cetera, to a care delivery model that's based on teams. With the doctor, a very important element of the team, but adding in all of the other bedside care delivery people as equally important elements of the decision-making process, the execution process, the follow-through process, et cetera. So I think that there's a growing realization that you really need teams to make things work. I think where we're kind of also evolving to is that, yes, at some juncture, somebody's going to be ultimately accountable, but it's also important to lead as teams, not just, we all manage as teams, but I think in healthcare, we have this unique scenario of, a doctor's been in college, medical school, residency, fellowship for 20 years, right? And you've got this healthcare administrator over here who's been through college and MBA school and years of experience. And you realize this person can never have this person's skill set. But if you can't marry the leadership model so that both things get done equally well, then you're gonna have a disparate, leaning of the organization one way or the other.
That's right. And that's why on our team, Lessons in Leadership, you got strong production people and creative people and hopefully a decent anchor with another great anchor who also organizes. And it sounds so corny to say it takes a team and a village to get it right. It's just so true. And that's what Dr. Varga is talking about. Hey, Dan, thanks so much.
Thank you, man. It's always fun talking with you and Mary.